One of the most common themes that comes up when people write to the Spine Center is fibromyalgia. And I'm really not certain why that is, because that certainly is not a surgical condition, but I think it has something to do with the frustration of living with a medical condition that is so devastating and yet is so poorly understood. What is fibromyalgia? Fibromyalgia is a widespread musculoskeletal pain that involves the entire body. It is frequently associated with sleep disturbances, fatigue, mood problems, memory disturbances as well. The underlying pathologic process that leads to this is not well understood, but it is a widely held belief that it has to do with the way the brain perceives pain signals from the body and somehow amplifies those signals. It can be very difficult for the physician to make the diagnosis because there's really not any specific laboratory tests that can help the physician make the diagnosis, and there's no specific physical finding the physician can point to say this is indicative of fibromyalgia. The diagnosis is based upon the patient's subjective complaints of pain and the physician ruling out any other underlying medical condition that could be producing the pain. In order to make the diagnosis, the criteria presently is the patient should have widespread pain involving both sides of the body, above and below the waist, and it should be present for more than 3 months. Previously, there were other criteria. They keep changing as we get additional information. Used to involve trigger points, but now that's the widely held definition. These patients also frequently have fatigue, cognitive problems, depression is very common, headaches, abdominal pain, cramping can also be seen. What is the cause of this pathologic process in the brain? Nobody really knows. Certainly there is a genetic link. It tends to run in families. Women have it much more frequently than men. It is not an infectious process. There is no infection that causes it, but it is known that certain infections can set it off. Also, physical and emotional trauma can set it off, and patients that have autoimmune diseases or rheumatic diseases more frequently develop fibromyalgia. If you think you have fibromyalgia and you're making an appointment with your medical profession, there's certain things you should keep in mind. Keep a detailed list of your symptoms because so much of the diagnosis is based upon the symptoms. You need to have a good understanding of your medical history and also the medical history in your family because, as I mentioned, there's genetic predispositions. You need to know specifically what medications you're taking and what supplements you're taking. And also, when you come to the physician, make sure you bring a list of questions. The doctor most likely will run some diagnostic studies. There are no specific tests to diagnose fibromyalgia, but that does not mean he's not going to do some tests. Most likely he will do a CBC, a sedimentation rate, which measures inflammation in the body, a thyroid profile, and an arthritis profile to rule out the rheumatic diseases. Remember, he has to rule out other known medical conditions which could be present. The treatment frequently involves the use of medications, and the medications are divided into 3 different types. You have pain medications, of which we typically recommend non-steroidal anti-inflammatory medications such as ibuprofen or Tylenol is also frequently recommended. For more severe pain, we'll use tramadol. It's recommended that you stay away from narcotics, though it's tempting, but narcotics tend to cause depression in and of itself. Antidepressants are also used for obvious reasons. People who have severe widespread pain that markedly interferes with their life obviously are going to be depressed, and antidepressant medications can certainly be beneficial to those patients. It has also been shown that certain anti-seizure medications can somehow help the underlying process and somehow minimize the way the brain is receiving the signals regarding pain. So they'll frequently use Lyrica, Neurontin, or some of those anti-seizure medications. Not only can the doctor help you, but there's plenty of things that you can do for yourself. You need to modify your lifestyle, reduce stress when you can, get plenty of exercise, get plenty of rest. When you do things, you need to pace yourself, and overall just you need to lead a very healthy lifestyle. You need to avoid smoking, drinking, as much as possible. Other things which have also been shown to be effective are acupuncture, yoga, Tai Chi, and massage therapy. I think one of the most important things you can do, however, is just become informed. Getting more information to help inform yourself, but probably even more importantly, your friends, family, and coworkers, because support with this condition is so important. Thank you very much for your time, and if you have a chance, leave some comments below. Thank you.